Another day, another video of first aid by. Can diabetes be reversed? First aid by. Diabetes is a serious chronic disease that affects millions of people around the world. It is a condition in which the body cannot produce or adequately use insulin, a hormone which helps the body convert sugar, starches, and other food into energy. Despite the severity of diabetes, there is a growing body of evidence that suggests that, in some cases, it can be reversed. What is diabetes? Diabetes is a chronic, metabolic disease characterized by high levels of sugar, glucose, in the blood. It occurs when the body does not produce enough insulin, or when the body cannot effectively use the insulin it produces. Diabetes can lead to serious health complications, including heart disease, stroke, kidney damage, and blindness. Causes of diabetes. A. Genetics. Genetics is thought to be a contributing factor for diabetes, with multiple genes involved in the disease. Certain gene mutations may make a person more likely to develop diabetes than others. In addition, diabetes tends to run in families, suggesting a genetic component. Genetic testing may be used to help diagnose diabetes and identify individuals at risk of developing the condition. B. Diet. Diabetes is a chronic medical condition that is caused by a range of factors. Diet is one of the main causes of diabetes, with poor dietary choices contributing to the development of the disease. Eating a diet high in sugar, simple carbohydrates, and processed foods can lead to an increased risk of developing diabetes. Eating a diet low in fruit and vegetables, and high in saturated fats and processed meats can also contribute to the development of diabetes. C. Exercise. Diabetes is a chronic health condition that occurs when the body does not produce enough insulin or cannot effectively use the insulin it produces. There are two main types of diabetes, type 1 and type 2. Both types of diabetes have a range of causes, which can include genetic factors, environmental factors, lifestyle choices, and other medical conditions. For type 1 diabetes, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Types of diabetes. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune disorder in which the body does not produce enough insulin, and type 2 diabetes is a chronic condition that is caused by poor lifestyle choices, such as an unhealthy diet and lack of physical activity. Both types of diabetes can lead to serious health complications, including heart disease, stroke, kidney failure, and blindness. Symptoms of diabetes. A. Increased thirst. Increased thirst is a common symptom of diabetes. When the body does not produce enough insulin, or when it can't use the insulin it does produce, the body's cells are unable to absorb the glucose from the bloodstream, which leads to a condition called hyperglycemia. As the body tries to rid itself of the excess glucose, it causes an increase in urination and an increase in thirst. This is because the body needs to replace the water it is losing by excreting more glucose in the urine. B. Frequent urination. Frequent urination is one of the common symptoms of diabetes. When a person has diabetes, their body is unable to regulate blood sugar levels. As a result, the body will try to get rid of excess sugar in the blood by releasing it through urine. This can lead to increased urination, particularly during the night. Additionally, frequent urination can lead to dehydration, which can cause other health issues. If you are experiencing frequent urination, you should discuss this with your doctor to determine if it may be due to diabetes. C. Weight loss. Weight loss is one of the symptoms of diabetes. People with diabetes may lose weight without trying, even though they are eating more than usual. This is because the body is unable to use the energy provided by the food to its full potential. Other signs and symptoms of diabetes include excessive thirst, frequent urination, blurred vision, fatigue, and slow-healing sores or cuts. If you are experiencing any of these symptoms, you should contact your doctor for a screening. Diagnosis of diabetes. A. Blood sugar testing. Diagnosis of diabetes is typically done through blood sugar testing. This involves taking a sample of blood and testing it for glucose levels. If the levels are higher than normal, it can indicate diabetes. Other tests, such as an oral glucose tolerance test or a fasting plasma glucose test, may also be necessary to confirm a diagnosis. Proper diagnosis of diabetes is critical in order to ensure that the appropriate care and treatment can be administered. B. A1C test. The A1C test is an important tool for diagnosing diabetes. It is a blood test that measures a person's average blood glucose levels over the past 2 to 3 months. A high A1C test result can indicate that a person has diabetes, or is at risk for developing it. People with diabetes should be tested for their A1C levels at least twice a year. An A1C test can help a healthcare provider determine if a person's diabetes is well managed, or if they need to make changes to their treatment plan. Making lifestyle changes such as increasing physical activity, eating a healthy diet, and reducing stress can also help reduce a person's A1C levels. Treatment of diabetes. A. Diet. Having diabetes can be a difficult condition to manage, but with the right diet and lifestyle, it is possible to control your diabetes and lead a healthy, happy life. A healthy diet is an important part of managing diabetes, as it helps to regulate blood glucose levels. Eating a balanced, nutritious diet and maintaining healthy body weight are important to maintain optimal blood glucose levels. A diet for diabetes should include a variety of healthy foods, such as fresh fruits and vegetables, lean proteins, whole grains and low-fat dairy products. B. Exercise. Exercise plays an important role in the treatment of diabetes. Regular physical activity helps to keep blood sugar levels in check, controls weight, lowers cholesterol, and reduces stress levels. Exercise can also improve insulin sensitivity, and help the body use insulin more effectively. People with diabetes should aim for 30 minutes of moderate intensity exercise at least 5 days a week. Some activities that are beneficial for diabetes treatment include walking, jogging, biking, and swimming. C. Medication. Diabetes is a chronic condition that requires ongoing medical attention and self-management. Treatment of diabetes focuses on keeping blood glucose levels within a target range. This can be achieved through lifestyle changes such as healthy eating, regular physical activity, and avoiding smoking. In addition, medications such as insulin, metformin, sulfonylureas, and thiazolidinediones are commonly used to help control blood glucose levels. Thanks for watching.